Hello, everyone, and welcome to today's webinar. Thanks for attending today. Our topic is Get Serious About Winning the Race for Talent. Before we get started, I'd like to take a moment to go over a few housekeeping items. My name's Allison, and I will be the webinar organizer for today. We want to make sure today's presentation is extremely valuable for you, so we ask that you submit all questions by clicking on the question button in the control panel and typing your question. Your questions are only visible to me, so I'll collect all submitted questions and will moderate the Q&A session at the end of the presentation. Now, time for the main event. It's my pleasure to introduce today's presenters. We have Chris Herbruck, who's an Executive Vice President of the Arthur J. Gallagher Employee Benefits Practice for the Ohio branch. Chris leads a team that specializes in working with mid-market employers throughout the country by providing strategic employee benefit planning services. Areas of concentration include nonprofit, long-term care facilities, and privately closely held manufacturers. He also oversees the small group sector for the state of Ohio. Chris has been in the health benefits industry for over 25 years. Prior to joining Arthur J. Gallagher & Company, Chris was a director and shareholder of Herbruck Alder, an employee benefits firm headquartered in Cleveland. Herbruck Alder and Gallagher merged in 2010. Chris has continued to serve as a team leader. In January 2017, he was named Area Executive Vice President. Our other presenter is Jamie Dasher. Jamie started his employee benefits career in 2009 with Herbruck Alder. After a 5-year stint as a guidance counselor in Geauga County, Jamie returned to Gallagher as an employee benefits consultant in 2016. Soon after, he became involved in the health and welfare practice Gallagher's Select Market Group, serving small businesses in Northeast Ohio. In his years with Gallagher, Jamie's developed a focus on organizations with less than 100 employees, managing their unique service needs and helping them maximize the value of fully insured and self-insured products provided by insurance companies for groups in the under 100 employee market. Without further ado, I will now hand the presentation over to Chris and Jamie.
Allison, thank you for the introduction. We really appreciate it. We're hoping today's presentation is helpful and concise, and I will be happy to answer any questions as they arise, when they arise. Today we want to talk about talent and talent recruitment and retention and the race for talent, and that's what we'll be focusing on today. We want to provide you with some benchmarking of what others are doing in the market for groups your size, and we want to discuss about making you look better. And better is a philosophy that we adopt at Gallagher, trying to make all of our clients look better. It's a very broad, vague topic because what better looks like to every employer is different. But we will talk about making you look better as an employer and try to dig into what better might look like for you. And then as part of that, we will go into 3 market trends that we're seeing a lot of employers concentrate on in terms of making themselves look better from a recruitment and retention standpoint. And then we'll answer any questions you might have. So just very quickly, a lot of what we're going to talk about today is based on our national benchmarking survey. Our national benchmarking survey is one of the largest in the country, and we are what they consider the North Central region, and we have approximately 4,500 participants in this survey every year. And the nice thing about our survey is it is surveying employers of all sizes. So not just 2,000 life companies, but the 20 life company, the 50 life company, the 100 life company as well. And so we'll be using that for the foundation of a lot of our discussion today. So one of the things we wanted to talk about is, and you'll probably recognize this in your organization, we wanted to start with some of the top priorities that, as indicated by the employers in the survey, some of the top priorities that people are focusing on. And we will talk briefly about top operational priorities as well as top HR priorities. So As you can see from our survey last year, the most prevalent thing on employers' minds from an operational standpoint is attracting and retaining talent. With this very tight labor market, although that might be slipping a little bit, it is a very continues to be a very challenging market for employers in terms of hiring, and so they want to do everything they possibly can to hold on to the employees they have and get quality employees going forward. As you would suspect, operationally, most folks want to grow revenue and as well. But again, number one priority is gaining talent. Okay. Similarly, we also asked the question about top priorities, not only operationally, but from an HR perspective. And the number one priority remains the same. And that number one priority is to attract and retain talent. And as you can see, it's really the same regardless of the for-profit industry, nonprofit, Ohio, and for the small employer. They all have that as a top priority. Second place in the concerns are benefit costs. Third is culture. Engagement is fourth, and training and development. But as you can see, second, third, fourth, and fifth are all very similar in terms of how important they are to the employers. So one of the things that you'll see, one of the questions we ask is about projected headcount. And most employers are not projecting any decrease in headcount. Most are projecting either to stay the same or actually an increase in headcount. So again, this is why we thought this topic would be so important. So I want to spend a minute talking about what better looks like to you. And like I said, it's a very vague, broad topic, but there are many different ways to tackle this, and it all depends on a company's priorities and culture. And so we are not of the mind that one solution is the right thing for everybody. And so we see employers taking different approaches to this, and a lot of them are taking multiple approaches to this. But some of the tools that we utilize to help with this the retaining and attraction of employees include the employee benefits. They include executive benefits for key employees. They include adjustments to the retirement plan. The well-being and engagement is key. And when we're talking about well-being, we're talking about the whole person coming to work, not just a wellness program. So again, it's very important to take the time to basically sit down and articulate to yourself as an organization, what does better look like to you? It's not, hey, we just want to improve our benefit plan, or we just want to improve our retirement plan. How does it fit into the puzzle? And are the steps you're taking really working towards that goal? Because everyone has a different mentality about this. Just taking benefits as an example, some employers don't want to be best in class from their employee benefit plan. They might want to be the best place to work, but they might not want the best benefits. They just might want to be average. Some employers are offering benefits just because they have to. So again, it really takes some thoughtful reflection as to what you're trying to accomplish. And so that's a good starting point, is to reflect on that. And reflect on how are you going to make yourself better. So the next section, we want to talk about how your peers in the market do stack up. So we're going to go through some high-level benchmarking, primarily with regards to benefit plans, to show you where your peers are with regards to benefit plans. And again, there's no right or wrong answer here. It's just a function of this is where the average, the median is, and where do you want to be in relation to the median. So one of the hot topics all the time, and one of the things that sometimes employees will go to a job for or leave a job for, is the employee contributions. And what you will see is in the Ohio market, the median contribution is 20% of the single rate is what they're charging employees. And it's for family, it's 30%. Now, there's been some shift in this over the past 5 years. It used to be, especially in the Ohio market, that single and that family percentage was almost identical. On the East and West Coast, for a long time, we saw a higher percentage for family contribution versus single. Locally, that has not been the case until much more recently. But with the escalating insurance premiums, employers have been kind of forced to go that way. Another contributing factor also has been the affordability rules under ACA, keeping the single rate down. You will notice that employers that are under 100 employees do have a higher contribution request on average. So it's 22% for single and 50% for family. And that's really born out of necessity. One other notable factor on the contributions would be nonprofit. And nonprofit is lower for both single and family. That is a trend that continues in the market and has continued for a long time. And the reason for that is nonprofits historically have used benefits as a bigger piece of the compensation package. Median deductible for non-HSA plans is $1,000, and that's pretty much that's true for Ohio, and under 100 and over 100. It's a little bit higher on the for-profit side. High deductibles, the median is right around 2,800, which is the minimum for an embedded deductible in the marketplace. We actually have seen that creep up. It's actually much closer to 3,000 now on the HSA in 2020. One of the things you have to keep in mind when you're looking at this benchmarking data, this is benchmarking data from 2019, which is the most current data available. However, this data, when published, is already 12 months old because it's looking backwards. So you got to keep in mind that this has continued to change over the past 18 months. Out of pockets, you'll notice that the median is around 3,000 or 3,500 for a single, and for a family, it's double, a little bit over double that, around 7,000. Very quickly, median copays. The average office visit is $25. The average specialist is around $45. ER is between $150 and $200. I will take a moment there to say under 100, we frequently see it above 200, even though it says 200. This is an area where employees have an opportunity to educate their folks on the proper use of the ER. So a higher copay generally is not a bad idea because the average ER visit is around $1,000 to $1,100, where your average physician visit is around $110, and your average telemedicine visit is around $49. So by all means, you don't want to encourage someone not to get care when required, but the flip side of that is you want people to use their services appropriately. Urgent care is about $50, very prevalent, as you can see across the board. The copay on telemedicine is around $20 or $25. And one of the things you always have to keep in mind is when you see these copays, those are the copays. Those aren't the cost of the service. That's the cost of the service. The copay is the cost of the service to the employee. So when you see a $200 ER copay, the average cost of that visit is $1,100. Okay, thank you for bearing with us through that benchmarking, but I thought it would be helpful for you to maybe get a sense of where you might stand, again, relative to the market. So very quickly, three areas or trends that I want to talk about quickly are employee choice, using technology to enhance your employee experience, and improve communication and engagement. First thing is choice. Choice is a trend that has been around for a while, but it continues, and it actually is becoming more prevalent. Many small employers don't think they can have choice or are reluctant to put in choice, but it is quite common. And with multi-generations and multi-age groups working at employers, it makes more and more sense. And there is a direct correlation to employee satisfaction when an employee can, for lack of a better term, right-size the benefits to them. So it's pretty safe to say one plan, if you have one medical plan, it's not going to meet everyone's needs. Someone's going to want less money out of pocket and a lower plan. Some people are going to want more money out of their pocket so they can have a richer plan. And you're not going to be able to satisfy everyone. So there continues to be a prevalence in choice on medical plans. And as you'll see from this chart, at least 60% have 2 to 3 medical plans. And it's important to understand, even in the under 100 market, when you add up the 4 right columns, you're looking at over 50% have somewhere between 2 and 5 medical plans. When we're talking about choice, though, we're now also not talking about just medical plans. There are ancillary benefits that many employers offer. And again, it goes back to right sizing, because some employees aren't going to need your medical plan. So again, offering choice is the key. And as you can see, about 95% of employers offer a dental plan. 80 to 99% offer life insurance and vision and short-term critical illness and hospital indemnity. So you can see that there's a lot of choice. Part of this choice trend has to do with voluntary products. And there's been a big shift in the voluntary product market. And the reason for that shift is there's 2 or 3 very important factors resulting in that increase in the voluntary market. One is there's more and better competition. So if you go back 10 years, there were 1 or 2, 3 players that had very aggressive sales tactics. Now that market has changed dramatically. There's a lot more players. The approach is much more professionalized, and so it's becoming much more widely adopted. A second big reason is because medical plans have changed. If you go back 10 or 15 years and you had a plan with a $250 deductible, there wasn't much need for a critical illness or an accident plan, because the medical plan covered really most of the costs. That's no longer the case. There are many plans with $3,000 deductibles, and these voluntary products serve a very important role. So those are a couple of things that have changed. And then the third, again, is the differing work stages that you find your workforce in. What's going to be right for one person is not going to be right for another. You know, if you have a young family who has a bunch of soccer players on their team, an accident policy is going to make a ton of sense. And for other people, it won't, just as an example. Again, more voluntary products on this page, but I think it's all important to recognize that products that we may have even laughed at a few years ago are becoming much more prevalent. As you might expect from everything on the news, tuition assistance, 529s, that area in the past 2 years has absolutely exploded. And it's a good opportunity to be competitive because a lot of employers haven't gotten there yet. And so it gives some employers an edge. If they don't necessarily have to provide tuition assistance, they might be providing tuition assistance in the form of debt restructuring, or they might be providing assistance in terms of a 529 plan, payroll deduction. So there's different ways to do it, some which will cost you money, some which will not cost you much money at all. Other areas that, again, you would have never heard of 10 years ago is pet insurance. We're seeing it with legal insurance as well. ID theft's not on this page, but that's another hot one, as you might expect. Very quickly on retirement, almost everyone offers a retirement plan. At least 75, in most instances, 70 to 85% of the employers are offering a match. One, employee readiness retirement readiness is another hot topic. Another trend in the market is employee retirement readiness. And that means, again, the whole person coming to work. So it just doesn't mean retirement planning. It also means being a smart consumer on your health plan. It also means Medicare education. It also means Social Security education. So these are things that we do, or that are being done for employers to help educate their employees, and that has many benefits. It helps the whole employee come to work, have less stress. It frankly helps an employee maybe retire when they wouldn't otherwise retire. So there's a lot of benefits to these programs. Next is how technology and communications can help make you better. So technology remains a hot topic. And when we say technology, we're primarily talking about HR information systems, HR technologies, so enrollment systems. And you will see it's a little bit trickier in the under 100 market because of the lack of electronic data interchange with the carriers, but it's still being used quite a bit. And we're seeing that employers are putting this in to differentiate themselves. So ways that employers are using it is it's improving efficiencies. Employers are using it are becoming more savvy with their onboarding in terms of the technology, even in the small market. And then employee communication and engagement is key. So you can do your entire benefits enrollment via the technology platform. You can use avatars. You can have portals. But this is a big differentiator, especially in the small market. Another area that is very, very important and a hot topic, it's under technology, but it could also be a topic in and of itself, and that is decision support tools and consumerism. So one of the areas that you can have an immediate impact in terms of reducing your cost and helping your employees is via consumerism products. And that can take the shape of telemedicine, but it also can take the form of electronic concierge services or price shopping tools within your medical plan. But these are tools that are not only going to save you money as an employer, but are going to improve your employee satisfaction because you're helping them save money and you're showing them you care about them. And what we find frequently, and it probably doesn't apply to anyone on this call, but what we find frequently is a lot of employers aren't aware of the tools that they already have available to them through their carriers. And so it's important to dig into what you already have. And so one of the things that the key consideration that we put at the bottom here is, make sure you properly vet. If you're going out for the first time, make sure you get help vetting the system. But if you already have a system, make sure that you maximize the benefits of that system. And as you might suspect, we have people that help you do that. So how can communications help make you better? So with regards to communications, we use the term communication. We might more appropriately use the term engagement because people, as you know, your associates get bombarded with information. And so that's why you have to have a well-structured communication campaign to help your prospective employees or your current employees in terms of connecting with them. You have to have a good communication campaign, and you want to avoid a generic message. So what we've laid out here are some simple steps to help you with a communication campaign. And the first one sounds obvious, but it is an important starting point, and that's to determine the message you want to deliver. The equally as important is the medium by which you want to communicate. And we have many employers that use various methods of communication. Some employers do communication books, or some do straight online portals and technology. Many do both, because within any workforce, you're going to have, again, different generations and different capabilities within a population. So determine what mediums work best for you. Is it an internet? Is it paper? Et cetera, et cetera. As I said in the last slide, you need to assess the tools and resources currently available to you. And this is true for consumerism, any price transparency tools, or even well-being resources. Create a calendar. The key is to keep it simple and sustainable. It doesn't have to be over the top. It needs to be able to be sustainable. That is the key. So once you've done all that, then implement it and then review it annually, improve and rinse and repeat. Okay? So there's many, as I said at the beginning, there are many different ways to make you better and improve communication or improve your retention and recruitment. But these are three of the methods that we are seeing employers use. And so, again, the answer is going to be different for every employer, and you should rely on your consultants to dig into what's going to make you better so that you can, again, recruit and retain the good talent. Gallagher can provide to you custom benchmarking. So we started with the benchmarking today. We would be happy to benchmark any of your plans up against the local and national benchmarking if you had interest. We also have a talent and retention toolkit that starts with a survey to find out what your priorities are So that would help us focus on which of these tools are right for you, or at least prioritize. Maybe all these tools are right for you, but you need to prioritize them. And then lastly, we can provide you with a checklist, if you have any interest, that walks you through all the different tools that you can utilize to make your place of employment more attractive. So Allison will be emailing this list to you, and you can contact Jamie for any of these materials if you have any interest. So that's all we have for today. Are there any questions?
Thank you. Well, first of all, thank you, Chris and Jamie, for sharing so much great information and insight with us today. I feel like that was a presentation jam-packed with information. Now it's time to take some questions from our participants. If you have a question, please type it in the questions box in that little panel on the right side of your screen, and we will get through as many of them as we can. We're making pretty good time here, so we have time for some questions. First up, I have a few questions that have been submitted already. Question number one is, and it's a very timely question, do you think a company's well-being, that slide, this was in one of the earlier slides you showed, will be affected by the coronavirus scare going on right now?
So that's a great question. So the short answer is, will well-being be affected? I'd say the answer to that is, in my opinion, is no. So if you go back, again, I don't mean to be too historical, but if you go back 10 years, the hot topic was wellness, and there was a focus on physical wellness, biometric screenings, measuring things like your cholesterol, et cetera, et cetera. And that's still very important, and I do not want to minimize it. But over the past 10 years, this has become a much broader conversation, to be the conversation of well-being, where we're not just talking about the physical well-being, but we're also talking about all components of the person. So we're talking about financial well-being, community well-being, social well-being, and physical well-being. So we're talking about the big picture when we're talking about well-being. In terms of the immediate impact of the coronavirus, employers do need to take action and have an action plan for their employees, and not to be alarmist, but to be prepared. And Allison can provide you with that guidance. Gallagher has published guidance specifically on this topic of what employers should do.
Okay, thank you. Next up, this is a question from someone who says they are starting a company and just beginning to build their benefits package. They want to know what's the first thing they should consider when building the package.
Well, I'm not entirely sure about the question, if they're talking about prioritizing which benefits, or if, yeah, I'm going to answer in the context of prioritizing benefits. But if the employer needs to first ask what they're trying to accomplish. But if you look at, again, prioritizing, everyone has limited resources, obviously. The single most important benefit to offer is going to be medical. And then the second most is going to be the retirement plan. And then frankly, I'm answering this from an insurance perspective, not necessarily a PR perspective, but the third most important benefit an employer can have, in my opinion, after the medical and the retirement plan, is a good, strong, long-term disability policy. Now, many times an employee doesn't see the value in that, but it is one of the most important benefits that an employer can offer.
All right, great, thank you. And I have one more question. It looks like this is probably going to be our last one, unless we get any last minute coming in.
Okay.
This person is looking for more details about how you can vet your payroll benefits, et cetera. The question came in during the technology slide.
Yep. It's a great question. There's the old way would be that someone would go try it. They would hear a lot of popular company names, and they would take the time to meet with them. And it's much more complicated than that because it's much more complicated than that because you need to dig into what an employer has the ability to do and doesn't have the ability to do and doesn't just get a sales job. Gallagher has a HRIS technology team that can provide consulting, some of which can be done at no charge, to help an employer with that selection process. But if it's not Gallagher, the recommendation would be to try to find a trusted advisor who can help bring multiple options to the table. And that, again, starts with listening to the employer and finding out what they're trying to accomplish with that technology. That's the starting point. And then from there, have a trusted advisor help you find a menu of choices and ask lots of questions because the technology is it's quite in-depth, as you would expect.
Got it. All right. That was our last question. Thank you again so much, Chris and Jamie. And thanks to all of you for participating in today's webinar. Everyone, please watch your inbox for a message that includes a recording of today's session, as well as Jamie's contact information to get that further information mentioned in the presentation. We hope you found this webinar engaging and informative. If you have any thoughts to share, please let us know. And this concludes today's session. Thanks again, everyone.
Thank you, Allison.